He's got his hand pressed against his jaw so hard I can see the tendons stand up in his wrist. Rocking a little in the chair, eyes wet, not from crying, from pain. "Just pull it," he says. "Please, just pull the tooth out." And I have to tell him I can't, not won't, can't. Not because don't want to help him. Because I'm not trained to. I am not a dentist. I did not go to school to become a dentist. I went to school and trained to become a physician assistant. This is one of the moments this job gets hard in a specific way. Not the blood, not the codes, not the 3 a.m. chest pain. This one. Watching someone in real pain, believing I'm the person who can end it, and having to explain that I'm not. I see this more than you'd think. Broken tooth, cracked from a piece of ice or a fall, or just years of wear finally giving out. Abscess, that deep aching pressure that builds for days until the whole side of someone's face is swollen and hot. Or just plain bad dentition. Teeth that have been going bad for years because a dentist visit costs money a lot of people don't have sitting around. They come to us because we're open at 2 a.m. and a dental office isn't. Because we don't ask for money up front, because when the pain gets bad enough, the ER is simply the door that's unlocked. And here's the part I have to sit with every single time. There isn't much I can actually do. If someone can safely take it, no allergies, no kidney problems, I can give real dose Motrin, not the 2 tablets you'd grab off a shelf. Sometimes an antibiotic if there's a real infection brewing. And if there's an abscess sitting right there under the surface, obvious, ready, sometimes I can drain it. That's it. That's the list. I can't pull the tooth. I can't fix the decay. I can't undo what's been happening in someone's mouth for the last 10 years in the 15 minutes I have with them tonight. I know what that pain feels like too, which is exactly why this one gets to me. I had a broken tooth myself not that long ago. Jagged edge, throbbing, the kind of pain where you catch yourself holding your own jaw the same way my patients do. I called my dentist, and you know what she gave me? Motrin. And an antibiotic. That was it. My own dentist, the actual expert, the person who does this every day, reached for the exact same 2 things I reach for in a hospital gown at 3 a.m. She didn't offer me a narcotic, didn't even bring it up. That's not her cutting corners. That's the standard. Even dentistry itself doesn't lead with narcotics for tooth pain anymore. The actual dental guidelines say non-steroidal anti-inflammatory drugs, things like Motrin, are the first thing to reach for, and opioids are the backup plan for when that's not enough. So when a patient's furious, I won't write a script for something stronger. I understand the frustration completely. I just also know their own dentist would have told them the same thing I'm telling them. And dental pain isn't rare in the ER either. It's steady, reliable, a couple million visits a year, nationally. We see it constantly. What's rare is somewhere that can actually fix it on the spot. A handful of hospitals are attached to a dental school and can get someone real dental care urgently. Most of us aren't. Most of us are exactly what I described. Motrin, maybe an antibiotic, maybe a drain, then a name and a number for a dentist and a hope that they can actually get in. Here's the gap, and I think about it every time I walk into one of these rooms. The patient in front of me is expecting an ending. They want the pain gone tonight, the tooth handled, this chapter closed. What I'm actually able to offer is a pause button, something to get them through until they can see someone who does this for a living. Those are not the same thing, and nobody explained that difference to them before they walked through my doors. Years of a bad tooth, gum disease, missing teeth. Sometimes that's the cost of a dentist visit. Sometimes it's years of just not going. Probably both. I'm not here to lecture anybody about flossing. I'm here to get them through the night as gently as I can with the small stuff I actually have. There is one version of this where everything I just said flips completely, and I want to be honest about that too, because it's the difference between annoying and dangerous. If that infection starts spreading down into the floor of the mouth, into the neck, and the swelling starts closing off the airway, that's not a dental complaint anymore. That's Ludwig's angina, and it can kill you by suffocation if nobody catches it in time. That patient isn't waiting for a Monday appointment, so that patient is getting admitted, getting antibiotics through an IV, an ENT consult, and sometimes getting a breathing tube before things get worse. Most nights, though, it's just me, a swollen face, and a short list of things I'm actually allowed to do about it. I hand over the Motrin. I write the antibiotic. I tell them honestly that I wish I could do more, and I mean it every time. If you've ever sat in an ER with a screaming tooth and walked out wondering why all you got was ibuprofen and a phone number, now you know, and I hope it stings a little less. That's what this channel's for, so hit subscribe if you want more of the truth nobody explains to you in the moment, and if this helped you understand your last ER visit a little better, do me a favour and like it. Dental pain brought a lot of people to this video, and there's a good chance it'll bring a few more of your friends too.